Hello, I'm Dr. Robert LaLouche, a board-certified OB/GYN physician with over 30 years of experience. Today we're going to talk about varicose veins in pregnancy. Varicose veins are something that run in families, so if you're experiencing this during pregnancy, probably can look at your parents or grandparents and see that someone had them. Over time, we all, as we age, our veins start to dilate a little bit, but sometimes they do it more in pregnancy. And the reason for that is the hormonal changes of pregnancy are designed to allow the veins to dilate a little. As your uterus grows, it has more blood flow to feed the baby, and that change leads to more dilation of your blood vessels and your veins. So your arteries are the blood vessels that come from your heart to go to your body, bringing oxygen. And then as the blood gets all the way to the ends of the organs, it comes back through your veins towards the heart, and veins are carrying blood that don't have oxygen, and that's why they're blue. So the veins, how does it come back? Well, the veins have valves in them that are one-way valves, and when your muscles squeeze, they push the fluid back, and it goes one way, which is towards your heart. And when the blood tries to go back down from gravity, let's say in your legs, the valves close and prevent the blood from going. That's how you get blood to come back. Well, those valves become leaky when your veins dilate. They stretch out, and so they can't close totally, and that's why varicose veins can often lead to edema, swelling of the legs, okay? If you do have varicose veins, it's important to keep moving because you're a little bit higher at a little bit higher risk for blood clots or deep vein thrombosis or superficial vein thrombosis. That's the ones that you see. Deep veins you can't see. And so you might wear some compression hose. There are maternity compression hose, or at least going way up as high as you can to help keep those vessels constricted. Sometimes you might find that your physician recommends a baby aspirin for you to help if you have aching discomfort or to reduce your chance of clotting, but be sure and ask your physician about it, and that's a low dose aspirin, not a full dose. That's not recommended, and that's contraindicated in pregnancy, okay? There's no real treatment during the pregnancy. Afterwards, when you're done having kids, you might need some treatments to take care of those. They might not fully go back to normal. And during the pregnancy or whenever, if you have them, you are at risk for a blood clot. If that, so that it's a blue bump that runs linearly up your legs, and and it should be a little mushy. If you notice it to be be hot, firm, that might indicate a blood clot. If you don't have significant swelling, that usually isn't an instant emergency. However, if you notice significant swelling, that could be a deep vein thrombosis, and that can be a dangerous risk, and you need to be seen or get that looked at immediately. But if you notice a small clot, that would be something to mention before that increases your risk of getting the more dangerous deep vein thrombosis. So be sure and discuss that with your physician and be on alert for the clots. You can have them in your legs. You can also have them in your vulva, in the lips, labia of your vagina, and they can look blue, and they can cause a lot of discomfort as well, and swell as time goes on during the pregnancy. When you come to the end of pregnancy, you should mention it to your physician. There are different interventions that can help if they're really aching near the end of pregnancy. Sometimes getting in Trendelenburg can help. That's where your head's here, you're in like a recliner, your bottom's here and your feet there, going backwards, taking the pressure off. So those are some of the things that can help. Once you're done with kids, if you still continue to have varicose veins, there are different treatments for that. That's beyond the scope of this discussion. Just know that you can discuss that with your physician, and they might do an appropriate referral for you to get an intervention if necessary. Hope you found this helpful. Thank you.